right, we are opening our meeting at 6:02 PM. Let's handle, I guess, minutes from last meeting. Everybody had a chance to look at them, all in favor? Or actually, I make a motion to accept the minutes.
Because I wasn't there.
Oh, that's right, just put your eye. I make a motion to accept the minutes. Second. All in favor?
Aye.
All right, just to let those watching at home, we had an executive session planned for today, but that matter has been taken care of, so we won't be going to executive session at all, so that's not on the table. I guess, so we have the hearing for the private wells of water supply at 6:05, so do you want to just do a little, maybe...
A little background on that? maybe?
Yeah. So,
So what's, for the board to consider tonight is changing the regulation that you've had in place for a number of years, requiring a 120-foot setback from the leaching area of a septic system back to 100 feet, which is the state Title V sanitary code requirement.
It was 110 though.
110.
It was
okay.
110.
Thank you.
yeah.
So reducing that back to 100 and following the state regs is what's on the table tonight for the board to
That's
consider.
fine, that's fine with me.
Yeah, I think when we did it, it was probably 15, 20 years ago, we did it just to error, more, because I think at that time.
I think
people were
it was a
worried.
lot of like the smaller areas that were getting impacted, like the Finn Park area
Yep,
and
yeah.
Cool Sandy, and
Yeah,
that we wanted to have that little extra buffer just in case there's a lot line violation or something in there, so.
right. So we need to just give it till 6:05, right, Lynn, for the hearing, just in case anybody wants to show?
Yes, it's 6:04,
Okay,
so.
so we're waiting. Butch, what are your thoughts?
I'm all for it.
Yeah.
It's 6:05.
Cool. All right, I make a motion that we do push the, back to 100 feet on the private well water supply regulation.
I'll second.
All in favor?
Aye.
Okay, and Lynn can change that, and we have to post that
Yep.
change
Yep.
and notify the town clerk.
Yep, perfect. I know the coronavirus is kind of next in line, but let's do Devereux, get that out of the way, and then we can handle the coronavirus
Okay.
piece.
So I've met with the nursing staff as far as COVID-19, and they're very well on top of protecting their campus. They've stopped students going home and stopped parents coming on campus, so to try to keep it healthy on campus. Right now, we have no sick children other than beyond a normal cold or strep throat cases there, so we're very good health-wise there, other than the normal stuff that they deal with on a weekly or monthly basis. The new program that Devereux is going to be doing is working with the federal government. So when kids and families cross over the border and they're caught, they're going to be accepting in the 5 locations that Devereux School owns across the United States these children, and they'll be housing them, getting physicals, medical checks on these kids, and keeping them until the federal government decides whether they get deported back or not, or they're gonna be allowed to stay in the United States. So the potential is for us in Rutland at the Devereux facility to have some of those children flown into Logan. Devereux would pick them up, and they would be their sole caregivers until such time as it's decided whether they stay or go.
So Devereux is the first place where they're, I guess, physically checked out, and,
Yes.
or, so not even when they come in?
Well, there's basic screening at the border.
Yep.
By the federal government employees. And once they meet those criteria, then they will be sent to these facilities. And Devereux has 5 across the United States, with 1 being here in Rutland. A dedicated building will be used at the Rutland facility for these children.
Okay. And what's the age limit, or?
Adolescents,
Okay.
just, yeah, under 18.
They say the possible number they could be getting, or is it just?
Initially, we talked 10 to 12. So they want to announce that. I went there and I met with the nursing staff, and they wanted to make sure we knew about that. Their primary care physician is Dr. Jeremiah at the regional UMass facility in Barry. And that's where they take their students for physicals and medical checks.
Now, will they be doing a coronavirus
That's,
or a COVID-19 test
that I'm not
before they're
sure.
admitted?
That I'm not sure, but that's a very good question that we should have an answer to. So I can follow up with Rebecca, the director of nursing over there, and make sure that happens on the border side before they get
Because
transported here.
the feds are pushing for testing.
Yeah.
Yes.
Yeah. But that's also been, I mean, mostly US citizens that we've been seeing, so with these folks not being true US citizens, I wonder what the protocol will be, you
I
know?
was gonna say, can we legally require that if they're coming in from out of state to come?
Well, if they're illegal, that's all
I mean,
on
to be
us.
tested.
You would
Can't we
think
do
so,
whatever
but I
we
mean,
want to?
Yeah, right, I mean, I guess.
I mean, not
we
legally, I
would
suppose,
bring that
but-
up with
Yeah,
Devereux too.
That would be one of
Yeah.
my concerns, is that they be allowed to be tested.
Yeah,
right. So I'll follow up with Rebecca and get some answers and relay that back to the board.
so this building they're gonna be held in, was this always like, is this something we have to inspect for? Or is this something that it's just one of their dorms that they?
It's one of their
they're now-
dorms
okay.
and they're down on enrollment, so they're gonna dedicate X amount of rooms for those
Got it.
students.
When's this gonna start, Rich?
Soon, real soon.
So we should check that it's been sanitized
Yeah.
Yeah.
I would
Yeah,
assume
yeah.
to some,
They're, I
to
mean,
some extent.
when I met with them, they've ramped up their cleaning staff for the disinfecting and sanitization of doorknobs and press bars and where the kiddos are living now and bathrooms and all that stuff has been ramped up with their staff. And we talked about that when I met with them this week. But we can certainly reiterate that when I call Rebecca about that.
Yeah,
building
just to be safe.
and make sure that they're doing extra work.
Yeah. Okay. So I guess now the lovely topic of conversation is the coronavirus. I assume everybody has seen that, you know, there's one confirmed case here in Rutland. We're trying to find out, you know, just, obviously not the person's name or anything like that, but we're trying to find out where they may have had contact with other people in the town, you know, whatever we can, obviously the HIPAA regulations kind of limit us to what we do know, but anything we
But
can
we
find
should
out.
be able to ask through a certain agency.
Yeah, that, with
Somehow.
the nurse is through Sutton, she's the one taking the lead on that. And we did ask her, you know, to find these things out if she could. We just have not heard back from her yet, but, you know, at least we can, you know, get as much information as we can, if, you know, to find out if there others need to be tested or quarantined.
If they
or
were
what
part of
have
that Biogen
you.
thing or.
Right, exactly, yeah,
Right.
yeah.
So the public health nurse that you contract with is doing the case study, and she was gonna meet with the individual and the family today to develop that list of contacts and potential events that the family may or may not have had over the course of time to be able to notify those people appropriately. As far as the address, age, male or female, or name, we are not gonna get that information. The only way we get that is the person has to voluntarily agree that that becomes public. But she knows who it is, and she's doing the case visit to the home, and following through with the quarantine, making sure that that's all done properly, and that the person is being medically treated as needed. That case study was supposed to go on this afternoon, and I was expecting a phone call before the 6 PM meeting, but I haven't gotten that back from the nurse that works on your behalf yet.
So if we do, we can, you know, figure that out.
And how does that work with us? Do we have to report that? Does that report it to the state, or does that just stay in town, or?
So she handles all that
She
reporting
does
on
that
your
reporting,
behalf.
I
Yeah.
think.
And I guess, you know, if there is, you know, that person went here for dinner or something like that, you know, we would then, you know, follow up and do our due diligence to make sure whoever is aware of, you know, their employee, or whatever, you know, just to cover everyone's butt, you know, to make sure everybody's safe. But that's, you know, to the extent we can do.
Correct, yeah. And additional family members being tested, she'll work through all that during her case study with them.
Now, and I know that it's not our responsibility, but if, say that person was at a, I don't know, a dinner party of 25 people, 3 days ago, it's then the nurse's responsibility to contact those other people? Or does the
Yes.
nurse then forward that to the, the CDC or the
Department of Public Health, yes.
Department of Health, and then they then follow that up?
That is correct.
Right.
So that was part of her visit today, is to identify each and every individual this person came in contact with.
Yep, perfect,
And then they can follow up with each of them, people,
perfect.
to let them know that this individual was confirmed. And they need to be quarantined 14 days, watch what they do, check their health, temperature, all those things.
Now, I know this is probably premature, but as this escalates, we're totally not gonna be able to fund it.
Oh, God.
And
Yeah,
the state,
yeah,
and the
right.
state is not offering anything at this point to towns as far as any kind of reimbursement or
Would that fall under-
forwarding any federal
Yeah.
reimbursement that comes as,
Would that fall
like
under the state
natural,
emergency,
like,
though?
it's not natural disaster, what would you call
Right.
it?
So,
It-
Well, it's emergency
Yeah,
management
yeah,
stuff.
yeah.
so Chief Knight, who's the town's emergency management director, and chairperson of the Board of Selectmen, signed a declaration this afternoon. So you do have a Rutland state of emergency declaration signed as of this afternoon. So what that does is allow your community to be eligible for state and federal reimbursement. So going forward, each department head is supposed to track any and all expenses related to COVID-19. So that when and if those monies become available, we have those
We can
numbers of what
recoup
was
them.
spent. I did see Senator Goby announce this afternoon that for small businesses, I believe, of employees of 50 or less, there is a loan program that the federal government,
Yeah.
state is offering now.
I actually think the state was doing it too, though.
Okay, so maybe the state
Yeah, the state was, it was 10 million or something like that.
available,
Yeah,
yeah, for small businesses to apply.
yeah, yeah.
And no payments for extended periods of time and all kinds of things, but I didn't see all the particulars, but that's available now.
So just, Lynn, as we get anything, just, let's keep that in a running tally, just so we know. I mean, as Karen is right, at some point, that can be coming in, 10, 12 a day for all we know,
But like, for businesses, they'd apply through Seth
For
for
financial,
financial
well, the state and the
restitution?
federal government haven't officially announced that they're going to give monies to cities and towns yet. But by declaring the state of emergency this afternoon, you have a date and time now.
Were in place,
So anything going forward from here, shall the state or federal government start that reimbursement program,
And when the plans come around on the wheel,
anything
it'll-
occurred from this date and time on would be reimbursable at
Yeah.
typically 75-25% reimbursement. So the federal government usually does 75 and the state does 25, typically.
Now, people are hearing scary things out there today that within 48 to 72 hours, they're gonna shut down all businesses.
Okay,
It's
Yeah.
the rumor mill
Yeah,
that's coming around. From what Baker said tonight and from what Trump said, I didn't get anything like that out of it. They seem very safe
right,
where they are, unless they have a place like New Rochelle, New York, that they feel they
yeah,
need to
right.
correct.
isolate, something like
I
that.
think that's all gonna be play it by ear and type of deal,
Everybody's familiar that COVID-19 is a respiratory lung infection, and the symptoms can develop over a 2 to 14-day time span from contact or exposure. General symptoms of fever, cough, sneezing, shortness of breath. Severe cases can develop into pneumonia, fluid in the lung. Exposure is spread by the droplets transmitted when someone coughs or sneezes, fine droplets that go out through the air. So that's why we have a 6-foot recommendation to be from any other person. So if someone should sneeze and cough and they don't protect that sneeze and cough and the water droplets go out through the air, that's how it's transmitted. The 211 state phone line is activated, so anybody has questions, they can dial 211 and they can ask specific questions and get answers to their questions. So that's on all the websites now, including the CDC and the State Department of Public Health. 80% of the population younger than 60 typically recover very quickly. They just have like cold-like symptoms. Some of the smaller adolescents won't even know that they're carriers or even have it. Their bodies are very good medically, and they won't even realize that they're carriers. 15% of the population will have more severe symptoms due to pre-existing underlying conditions such as heart, lung, cancer patients, high blood pressure, diabetes patients will experience more aggressive symptoms and could cause hospitalization and need respiratory therapy, oxygen, and those types of things. 5% of the population will be critically ill from it and could cause death, depending on the underlying medical conditions an individual may have. And it doesn't have to be someone 60 or older. You could have a young person that has immunocompromised or medical condition
Right.
that would affect it, just like an older person. 60 and above, I guess, is the threshold that I keep here.
I guess the thing that's concerning to me the most is that I understand that a bunch of the adults and the elderly people, we understand what's going on. I get concerned with the younger people and the adolescents. I don't know how serious they're taking it right now. You know, so I suggest to all the parents to let them know, let their children know that,
Yeah.
you know, this is something that they could carry on to their grandparents, to elderly people, and that we have to kind of monitor that.
The
Yes.
kids seem
A
to
little bit
think
more.
that this is like the greatest
Yeah.
vacation
Yep.
to have. Let's go here, we'll go to Johnny's house. We'll go hang out
Right.
here. And it's not the purpose.
Right.
When I came to the office yesterday afternoon to talk to our food establishments via the phone, and Lynn, the basketball court had probably 15 kids playing basketball, so they're not getting the message about distance and staying away. And that's very important, as you said.
That's the parent, that falls to the parents.
Yes.
We need them, we need parents to really get on the kids about that. I know I've been with mine lately, but I think that's one of the best ways that we can control it more than anything is, it's gonna, I think the adolescents are the ones that are gonna be the ones that are, you know, less responsible, I should say.
Yep.
Yep.
Yep. Little Wonders is closing tomorrow, the daycare, and they're gonna take it on a week-by-week basis to see how things go and when it may be appropriate to open or not, even though CDC and Mass Department of Public Health and our governor has not recommended closing daycares yet. They're taking action based on their enrollment and safety that they feel they need to.
They just did because the amount of kids that they usually have,
That's a factor. One factor.
or the amount of employees that they have, and it was gonna cost them more to pay the employees for the lack of attendees.
I think enrollment is down, and some of that may be because older children in the home are home now and can watch the younger kiddos, or parents may be home now.
Oh, so it may be like a
So it may
3
not
week.
all necessarily be, I'm scared to send my kiddo to daycare, because now we have older high school kids at home and parents home that may normally not be around to take care of the younger ones. But enrollment is an issue. So they're just being somewhat proactive, I guess, and,
Well, maybe people are being cautious.
yeah.
In your talks with any of the food establishments, has anybody who didn't normally have a delivery, have they suggested they might do that? I mean, just that way, like, town, citizens would know that, somebody might be doing that?
They haven't mentioned anything about delivery. They are eligible for pickup or delivery. I think that it kind of might have took them all by surprise, because I think they anticipated they were still gonna be able to operate.
Yeah.
And that came down yesterday that they can't after tomorrow. Everybody's been very good about it. They get it, they understand why it's being done.
That they can't operate at all?
So they can do takeout and
Oh,
delivery
okay.
only, but no inside seating, dining,
Right.
or anything like that, and or bar. or
Right,
tavern.
tomorrow was the day.
Yeah, tomorrow's the
Yeah.
deadline, yep. So
Tula's is very slow. I noticed. Our whole parking lot is very slow.
Yeah, I'm hoping people are actually listening and taking the precautions that are being put out there to distance yourself and stay away from crowds, and it's gonna hurt the small businesses, there's no way of getting around it.
If somebody is on the cusp,
Yeah, oh God, yeah.
it could take them out, which is
Yeah.
sad.
The superintendent has provided meals for the school population and kids that do normally have breakfast and lunch at school as part of their program. I don't know the schedule. It was announced earlier today, but I don't have the particulars, but it is out on the website and the school's website, so that there are bag lunch and meals for those families in need available, which is good.
Is that through Naquag or
Uh,
Glenwood or?
I'm not sure.
Yeah, I heard something, but I don't know to be
Yeah,
fact. But I think it might be just one location possibly,
it may be one location,
you know.
And the senior center is closed too, correct?
yes, yes. Yep, town boards and committees are urged not to hold public meetings. Our meeting was important tonight, so we could discuss this and have this forum to get the word out to the residents of Rutland, but town office buildings are closed to the public. All staff are working behind closed doors, so we're accessible by phone, by email, or the online permitting system that the town has recently put in place. So we can do business as usual, you just gotta do your permits online, and we'll react accordingly, each department. Chief Knight currently has a sufficient supply of PPE for his people, and Chief Monaco, so they're okay right now, but again, it's a wait and see how many cases, how many sick people they end up transporting and dealing with as far as their level of supplies and what they're gonna need to get in the future and how that availability is gonna be. We're hoping the federal government opens up the cache, which for years now, we've been doing pandemic and epidemic planning, and cache of equipment. And so that stuff has been stockpiled, and hopefully that will trickle down to the communities that need it.
Well, I know today when they were speaking with the president, one of the emergency folks had mentioned that they were looking to get more PPEs out there to
Right.
to the folks, so.
And you're gonna see more testing centers open up and places to go for people to get tested. By the end of the week, we're supposed to have 1 million tests available, and the next coming days after that, 2 million, and within 2 weeks or less, 5 million available tests is what the president announced today during his press conference.
How do you see us operating a test site in town here, something similar to what we've done for the emergency preparedness
I think this would be
testing?
different, right?
But
This would
we'd be
more
doing it
drive-through.
with probably Wachusett, the medical corps.
Yeah, they would
Yeah.
probably be involved. We may not see that in our community only based on the population of
Right,
this-
yeah.
of the town of Rutland. You may see it in the bigger, like the Worcester and the
And depending
outlying.
what contamination is.
But you know, I mean, if we had to, I think Glenwood, not Glenwood, Central Two would be perfect because you have that
The road.
one way in
Yeah.
from, coming
And
off.
one
of-
way out,
Right, and
yeah.
so you could, if you had to, and it's kind of in the middle, so long lines won't go out to Main Street, it won't go out to, Pleasantdale, not Pleasantdale, it won't go up to Maple, so we could probably avoid that if need be. I mean, like you said, I don't think we'll ever be on the register to have that happen here. I
Right,
think we're just too small.
I think we are.
Well, fortunately, I guess.
But a neighboring city or town close to us, yes, I do see that coming in the coming days.
Yeah. All right, I think that's it on our list, unless anyone else has anything else we want to discuss.
I think we pretty much covered it.
All right. So that is it for our meeting. What time are we closing, Lynn? Sorry, I don't have my...
6:27.
6:27. And we thank those at home for watching. Have
I'll make
great
a
night.
motion to close.
Yeah, I make a motion, sorry. I make a motion to close our meeting.
Second.
All in favor?
Aye.